Today, I am going to discuss all about artificial and natural methods of contraception, including its example, the advantages and disadvantages, and also the possible side effects or risk. So first, we will tackle all about the artificial methods. So what are artificial methods? Artificial methods in common use include preventing the sperm from reaching the ovule using condoms, diaphragms, etc. Inhibiting ovulation using oral contraceptive pills, preventing the implantations using intrauterine devices, killing the sperm using spermicides, and preventing the sperm from entering the seminal fluid by vasectomy. One example of this method is the oral contraceptive pills. Oral contraceptive pills, or ECP, consist of the hormones progestin and estrogen, or only progestin, and must be taken orally once per day in order to prevent pregnancy. Oral contraceptives come in packets of 21, 28, or 91 tablets to take by mouth once a day, every day, or almost every day of a regular cycle. To avoid nausea, take oral contraceptives with food or milk. Take your oral contraceptive at the same time every day. The advantages in taking the oral contraceptive pills, or ACP, are: it does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon, and etc. However, the disadvantages are: it can increase your blood pressure, it does not protect you against sexually transmitted infections, breakthrough bleeding and spotting is common in the first few months of using the pill. It has been linked to an increased risk of some serious health conditions such as blood clots and breast cancer, and etc. The possible side effects or risk in taking the oral contraceptive pills are: it can cause nausea, breast enlargement, headaches, breakthrough bleeding, amenorrhea, weight gain, mood changes, blood clots, high blood pressure, liver tumors, breast cancer risk, and etc. Another example of this method is the transdermal patch. Transdermal patches adhere to the skin as a way to deliver drugs. It acts as a carrier for a drug, holding it until it's applied. At the point of applications, the patch adhesives secure it to the skin, and the drugs contained in the patch will begin to permeate into the bloodstream. The advantages of using transdermal patch are: it offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug-drug interactions. However, the disadvantages are: it can cause potential skin sensitizations or irritations, discomfort from adhesives, imperfect skin adhesions, cost and selectivity for specific physicochemical drug properties. The possible side effects or risks are: blurred visions and widened pupils may occur as your body adjusts to the medications. Dry mouth, drowsiness, dizziness, decreased sweating, constipations, and mild itching on application site may also occur. Next example is the vaginal ring. It is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones, estrogen and progestogen, into the bloodstream to prevent pregnancy. To use a vaginal ring, you squeeze the ring and insert it to your vagina like inserting a tampon. It stays in your vagina for 3 weeks. You then take it out and throw it away, and wait 7 days before inserting a new ring. The advantages of using vaginal ring are: it doesn't interrupt sex, it's easy to put in and take out, it may help with premenstrual symptoms, period type bleeding usually becomes lighter, more regular, and less painful. The ring isn't affected if you're sick or vomit or have diarrhea, etc. However, the disadvantages are: You can have spotting and bleeding in the first few months. The ring doesn't protect against STIs. You may not feel comfortable inserting or removing out from your vagina, and etc. The possible side effects or risks of vaginal ring are can cause headache, weight gain, nausea, breast tenderness, and vaginal irritation. Next example of this method is the subdermal implants. Subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rods placed under the skin. An implant is fitted by using either a local anesthetic injections or a freezing cold spray at the top of your arm. The doctor or nurse will then insert the implant just under the skin. Advantages: progestin implants include long-term contraceptive actions without requiring the user's or provider's attentions. Low-dose or highly effective contraceptions without the use of estrogen. And fertility is readily reversible after the removal of implants. However, the disadvantages are you may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. You may get acne or your acne might get worse. The side effects or risk. Many complications have been associated with subcutaneous contraceptions, including menstrual disturbances, headache, weight gain, acne, dizziness, mood disturbances, nausea, lower abdominal pain, hair loss, loss of libido, pain at the implant site, neuropathy, and follicular cyst. Next is the hormonal injections. The contraceptive injections prevent pregnancy by injecting a synthetic versions of the hormone progestogen called dipot medroxyprogesterone acetate or DMPE. It is injected every 1, 2, or 3 months or every 4, every 8, or every 12 weeks depending on the type. The advantages of using hormonal injections are each injection lasts for either 8 or 13 weeks. It does not interrupt sex. It is safe to use while you are breastfeeding. It is not affected by other medicines, and etc. However, the disadvantages are your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. It does not protect you against STIs. Any side effects can continue for as long as the injections last 8 or 13 weeks and for some time after, etc. The possible side effects or risks are you may experience headaches, acne, hair loss, decreased sex drive, and mood swings. Another example of this method is the intrauterine device. An intrauterine device or IUD is a small plastic T-shaped device used for birth control. It is placed inside the uterus to prevent pregnancy. The advantages in using the intrauterine device are it protects against pregnancy for 5 or 10 years depending on the type. It does not interrupt sex. Once an IUD is fitted, it works straight away. It is safe to use an IUD if you're breastfeeding. However, the disadvantages are your periods may become heavier, longer, or more painful, though this may improve after a few months. It does not prevent against STIs, and it may cause vaginal bleeding and pain, and etc. The possible side effects or risks in using the intrauterine device are spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during your periods, pain when your IUD is put in, and cramping or backaches for a few days after. Next example is the chemical barriers. Chemical barriers destroy pathogens on the outer body surface, at body openings, and on inner body linings. Sweat, mucus, tears, and saliva all contain enzymes that kill pathogens. Mechanism of use: spermicides are sperm-killing chemicals inserted deep into the vagina near the cervix before sex. The advantages of applying chemical barriers are barriers methods are safe to use while breastfeeding. Barrier methods do not use hormones. Barrier methods cost less than hormonal types of birth control. These methods do not affect a woman's menstrual cycle, and etc. However, the disadvantages are these methods do not prevent pregnancy as well as IUDs or hormonal forms of birth control. Barrier methods prevent pregnancy only if you use them every time you have sex. You may have to interrupt sex to use some barriers methods of birth control, and etc. The possible side effects or risks in applying the chemical barriers are an increase of developing urinary tract infections or UTIs if using diaphragm and spermicide. Leaving a diaphragm or a cervical cup in for longer than 24 hours increases your risk for toxic shock syndrome. Another example of this method is the diaphragm. Diaphragm is a small dome-shaped device made of silicone or latex that fits inside the vagina and covers the cervix. First, apply spermicidal gel around the rim and inside the dome of the diaphragm. Second, squeeze the rim or sides of the diaphragm between your fingers. Insert the diaphragm into your vagina. Tuck the front rim of the diaphragm up as far as it will comfortably go. The front part of the rim should be up behind the pubic bone. And last, reach inside the vagina with your longest finger to check that your cervix is completely covered by the diaphragm. The advantages of using the diaphragm are: you only need to use a diaphragm when you want to have sex. You can put it in a convenient time before having sex. You're only in control of your contraceptions, and there are usually no serious associated health risks or side effects. However, the disadvantages are: it does not provide reliable protections against STIs. Latex and spermicide can cause irritations in some women and their sexual partners. It can take time to learn how to use it, and etc. The possible side effects or risks in using the diaphragm are: the spermicides used with the diaphragm can increase the risk of getting HIV from an infected partner. It may cause vaginal burning and irritations from the spermicide. It may increase the risk of urinary tract infections or UTI. Toxic shock syndrome has occurred from use of the diaphragm. Next example is the cervical cup. It is a small plastic dome that fits tightly over the cervix and stays in place by suction. It acts as a barrier to keep sperm from entering the uterus. Mechanism of use: apply spermicidal gel inside the groove between the rim and the dome of the cup, in the bowl of the cup, and on the outer dome of the cup. Second, squeeze the cup between your fingers with the inside of the bowl facing up. Insert the cup into the vagina with the long brim entering first. Press the cup onto your cervix until it is completely covered, and last, check to see if your cervix is covered before and after each act of sex. The advantages in applying the cervical cup are: unlike the diaphragm, the cervical cup protects against pregnancy for 2 days and for multiple acts of intercourse within the time frame. When placed appropriately, the cervical cup is often not felt by either partner during sexual intercourse. However, the disadvantages are: the cervical cup is more difficult for women to learn to insert and remove than the diaphragm. High risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Mild allergic reactions to the silicone or spermicides occasionally occur. The possible side effects or risk of cervical cup are: the spermicides used with a cervical cup can increase the risk of getting HIV from an infected partner. Use of the cup may cause vaginal irritations or odor. Another example is the male condom. A male condom is a thin sheet made of latex or rubber, polyurethane or plastics, or natural or animal membrane that is worn over the erect penis during sex. Mechanism of use: place the rolled up condom over the tip of the erect penis with the rolled side facing out. Hold the end of the condom to allow a little extra space at the tip. Then unroll the condom over the penis. Right after ejaculations, grasp the condom around the base of the penis as it is withdrawn to prevent it from slipping off. Throw the condom away. Never reuse the condom. The advantages of using male condom are: when used correctly and consistently, They are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. You only need to use them when you have sex. In most cases, there are no medical side effects from using condoms, and etc. However, the disadvantages are: some couples find that using condoms interrupts sex. Condoms are very strong but may split or tear if not used properly. It can cause allergic reactions to some people, and etc. The possible side effects or risk of using male condom are: some people are allergic to latex or polyurethane and may have reactions. Next is the female condom. A female condom is a thin plastic pouch that lines the vagina. It is held in place by a closed inner ring at the cervix and an outer ring at the opening of the vagina. Mechanism of use: squeeze the inner ring between your fingers and insert it into the vagina as far as possible. Push the inner ring up until it is just behind the pelvic bone. About an inch of the open edge should be outside your body. Right after ejaculations, twist the outer ring close. Pull the pouch out gently. Throw the condom away and do not reuse it. Its advantages, disadvantages, and side effects is the same with the male condom. Last example of this method is the surgical methods. Vasectomy and tubectomy are surgical methods of contraceptions in males and females respectively. In vasectomy, the small tubes in your scrotum that carry sperm are cut or blocked off, so sperm can't leave your body and cause pregnancy. While in tubectomy is done by cutting and tying the fallopian tubes or by applying clips, clamps, or rings to the fallopian tubes. The advantages of using surgical methods are: more than 99% effective at preventing pregnancy. It will not affect your sex drive or interfere with sex. It will not affect your hormone levels, and etc. However, the disadvantages are: it does not protect against STIs, so you may need to use condoms. It cannot be easily reversed, and reversal operations are rarely funded by the NHS. There's a very small risk of complications, including internal bleeding, infections, or damage to other organs. The possible side effects or risks in applying surgical methods are: it can cause surgical complications such as internal bleeding, infections, or damage to the organs. So now, we will proceed to natural methods since we are done all about the artificial methods. So what are natural methods? Natural methods of birth control do not involve medications or devices to prevent pregnancy, but rather rely on behavioral practices and making observations about a woman's body and menstrual cycle. One example of this method is the abstinence. Abstinence means not having any kinds of sex with a partner. Sex includes vaginal intercourse, oral sex, and anal sex. Sometimes people use abstinence as birth control to prevent pregnancy. Abstinence prevents pregnancy by keeping semen away from the vagina so the sperm cells in the semen can get to an egg and cause pregnancy. The advantages in applying the abstinence are: abstinence is free, always available, and can be started at any time in your life. Abstinence may encourage people to build relationships and connect more ways that don't involve sexual activity. There are no medical side effects, and etc. However, the disadvantages are: many people may find it difficult to maintain abstinence over the long term. Choosing abstinence does not mean that your desire for sexual activity goes away, and etc. The possible side effects or risk in applying the abstinence are: experiencing aches and pain, increase in blood pressure and in stress levels, tightening of the vaginal canal for folks going through menopause, decreased prostate health, and spontaneous arousal levels may drop. Next example is the calendar method, also known as Rete method. It is a form of natural family planning. To use the Rete method, you track your menstrual history to predict when you'll ovulate. Advantages in using the calendar method: Thus, by calculating the midpoint of the cycle, women can also work out when they are potentially fertile and when they are definitely fertile. Sex can then be avoided or an alternative method of contraception used in the fertile days of the cycle. Disadvantages in using calendar method. It can be annoying to record and track your cycle every day. No protections against sexually transmitted infections or STIs, and challenging for people with irregular periods. And there are no physical side effects of calendar method. Another example is the basal body temperature. The basal body temperature is your temperature when you're fully at rest. Ovulations may cause a slight increase in basal body temperature. You'll be most fertile during the 2 to 3 days before your temperature rises. To use the basal body temperature method, first, take your basal body temperature every morning before getting out of bed. Use a digital oral thermometer or one specially designed to measure basal body temperature. Second, track your temperature readings. And last, plan sex carefully during fertile days. The advantages in using the basal body temperature are 100% natural, no side effects, eco-friendly, family planning, easy, effective, save money, and more. However, the disadvantages are it doesn't protect from STDs, not for every woman, adjustment time, and etc. Have no side effects. Next example of this method is the cervical mucus method, also called Billings ovulations method. The cervical mucus method is based on careful observations of mucus patterns during your menstrual cycle. To use this method, record your cervical secretions for several cycles. Starting the day after your menstrual bleeding stops, observe and record your cervical secretions on a daily chart. The advantages of using the cervical mucus method are: the cervical mucus method is good for determining when you're fertile by using your vaginal discharge as a way to determine where you are in your cycle. However, the disadvantages are: this method is not always easy to learn without the guidance of your OB or GYN or your doctor, and have no side effects. Another example of this method is the symptodermal method. It is a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature, other signs, and symptoms of ovulations. The advantages of using the symptodermal method are: it combines the calendar, cervical mucus, and temperature methods. However, these techniques shares the same disadvantages that each of these techniques has individually. The possible side effects or risk of applying the symptodermal method are: it can cause health complications including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. Next example is the ovulation detection. An ovulation home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone or LH in the urine. Mechanism of use: pee on a stick or strip, or pee in a cup and dip the stick or strip into the cup, and wait a few minutes for the indicator to appear. The advantages: ovulation test kits may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. The disadvantages: ovulation test kits can be expensive and there are no guarantees. The side effects or risk: can cause mild pelvic or lower abdominal pain. And the last example of this method is the coitus interruptus. Coitus interruptus, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. The advantages in applying the coitus interruptus are: it does not affect breastfeeding and is always available for primary use or use as a backup method Coitus interruptus involves no economic cost or use of chemicals and has no directly associated health risk. However, the disadvantages are it doesn't offer protections from sexually transmitted infections. The possible side effects or risks in applying the coitus interruptus are loss of sexual interest, limited arousal or pleasure from foreplay, impotency, development of defense mechanisms, body pain, and difficulty in urinating. And that's for all today. Thank you.